Okay. Hi everybody, my name is Andreas Lundqvist and this is my team. It contains of me, myself and I. This past year I've been part of a fantastic project which is called Clinical Innovation Fellowship, and as a part of this project I have the opportunity to follow physical therapists around in their everyday work. And when we did that, we noticed something very interesting that has to do with this. There is a test that is called the Åstrand test, which measures your maximal aerobic capacity, and it does this by your heart rate is correlated to your maximal aerobic capacity at a certain workload. So we followed them around and we watched them perform this test, and what we saw was quite interesting. Each time they were supposed to do one of these tests, they had to run around to collect all this equipment. They had their pulse watch, they had their heart rate monitor, they had a metronome, they had a stopwatch, they had some papers to fill in the information, and they had documentation to be able to analyze all the measurements that they made. So what me, myself, and I have done is that we have took all these six sensors and we put them inside a smartphone connected with Bluetooth 4 to a heart rate monitor. And this is what we've been prototyping the last 24 hours. So you could reduce the needed equipment to a smartphone and a heart rate sensor, as I said. And when you do that, you would gain accuracy by removing the need for subjective measurements and increase the repeatability by implementing the test algorithm in the smartphone. So the prototype looks something like this. You put in your age, your sex, and the current workload that you had on the bicycle, and you start the test. And you connect to the heart rate sensor, which starts to collecting all the data and analyze this. And the test is automatic from this point forward, unless the heart rate drops below a certain level where the test leader has to increase the workload to receive the proper results. And the result is pretty simple. It's 2.8 liters per minute, which is your maximal aerobic capacity. And by using this solution, the healthcare professional are able to focus more on the patient and during the test, and not to be the test leader. And perhaps there's also some interesting for the wellness as well, where you can track your health progress using this application. Thank you.
So if I understand you correctly, you're claiming that with your system you get both better measurements and it's easier to do. Is that what you're saying?
Correct, because they write down and they had to look up the pulse at the same time and sort of keep track of how the test is going. But this system can sort of automate it all.
Okay. And have you tried this, or this is a concept?
I haven't tried it, but it's a working prototype. So
okay.
I just have to find one of those special bicycles to try it.
Okay, thanks.
Thanks.